Hi, everybody. Thanks so much for joining us. We are doing a live Q&A update on COVID-19 in children and in our community today. We'll give everybody a couple moments to join in. We were hoping to do this yesterday. Really glad to be coming to you live today. So our guest today is Children's Hospital and Medical Center's hospital epidemiologist, Dr. Alice Sato. Dr. Sato is a pediatric infectious disease specialist here at Children's. She's also a professor at UNMC. So Dr. Sato, thank you so much for being here today.
Thanks.
Want to let everybody know if you have questions for Dr. Sato about anything about COVID-19, the place to put those questions is in the comments below, and we will do our very best to get to those as we go. So Dr. Sato, I want to start with a topic that's on everybody's minds, these COVID-19 vaccines, getting a safe, effective vaccine. What is kind of the latest on that front? And what does it mean specifically for children with the vaccines?
So we've had what we're starting to call Vaccine Monday, where we've been getting great news about vaccines, seems mostly on Mondays, and that's very exciting. So there are 3 vaccines that have announced results. There are actually over 100 vaccines in development around the world, and several in various stages of clinical trial. So we expect other news to follow, which is also good news. So the main thing that you've probably heard is that a couple companies, Pfizer and Moderna, have come out with mRNA vaccines. So this is a brand new type of vaccine technology. And what it is, it's a little bubble of lipid or fat with an mRNA or messenger RNA, which is an instruction to make a protein inside of it. And so it's not what some vaccine that tells the cells to make this protein, and it makes the spike protein, which is that ball on the outside of the virus. And that means that your body can do things.
I know Dr. Sato is frozen for me right now. I'm not sure if anyone else is having that issue. I think we caught back up.
Okay.
Yeah.
So it's the vaccines make the spike protein, and then your body can make antibodies that block that. Mm-hmm. And so it can coat the outside of the virus and keep it from infecting cells. Mm-hmm. What's really been encouraging is that they've been above 90% vaccine efficacy. Mm-hmm. So if you had a perfect vaccine, it would be 100%. And so when we look at the number of infections that have happened, almost all of them have occurred in people who got a placebo and not the vaccine itself. So this is great. That said, we've never had this type of vaccine before. So it hasn't been studied yet in children because, and it makes sense, the vaccine makers wanted to make sure that it was safe and effective before enrolling children into trials to look at this brand new type of vaccine. Mm-hmm. So we don't have information on children yet. They are starting to enroll older children, so teenagers, into studies. So we're hoping that that will continue to look good, and we will start to get more information on the safety and the efficacy of vaccine in children on 18 and up. And the other good piece of news is that these vaccines seem to work in older adults who sometimes don't have as good reactions. And so there is some data about older adults. This week's data was a different type of vaccine, but again, it's not something you would consider a live vaccine. Mm-hmm. Can't replicate and cause infection, but it does make also the spike protein. So one of the reasons that we find this really exciting is that many of the other types of vaccines, some of the more classical types of vaccines, are also based on making a reaction to the spike protein. So It's good news all around that we expect more good news, hopefully, to come forward with new vaccines.
Yeah, no, thank you for that update. And in terms of children, I mean, if you're talking about the timing of this rollout, I mean, there's no crystal ball here, but what do you know about, when people might be able to start getting it, who would get it first, and then when do you think would be the earliest that children would be able to get the vaccine?
So the initial vaccines are coming out in just a few weeks, but that is targeted to the highest risk, mostly healthcare workers, to start.
Mhm.
As there's more vaccine being produced, it will also get sent out. We are getting allocation based on the government. We'll decide how much comes to Nebraska specifically, and then Nebraska has a way to set up to distribute it within the state. So we are actually starting to see potential rollout dates. Now they have to get approval for us to use this vaccine
Mhm.
because they have not gone through the entire FDA approval process yet. That doesn't mean that there isn't data on safety and efficacy, but there's actually a very long, detailed process for full FDA approval that is going to take a while longer for it to be completed. However, they are applying for something called an EUA, or Emergency Use Authorization. You may have heard this term being used for some of the coronavirus tests were allowed to go out under an EUA, and some of the treatments that we've been using, like
Mhm.
remdesivir initially, and now bamlanivimab and the Regeneron cocktail and such, our drug treatments have gotten an EUA for us to be able to use them rather than waiting. And so there's a bunch of criteria to meet for that, and the benefit has to clearly outweigh the risk.
Mhm.
And I think we can agree that the benefit of protecting people with a vaccine versus the risks that have been identified, which are very minimal, mostly people not feeling great the day they got the vaccine, um, a little bit fluish is how some
Yeah.
people might describe it, where you feel a little bit achy and not great, which is a sign that your body is reacting to something. Because remember, things like fever are what we make, right? Fever isn't a sign of infection. Fever is a sign that your body thinks there's an infection and is fighting against it. So your body makes a bunch of reactions. And so we're not surprised that we see little bits of reactions like that. And sometimes if you've had a flu shot, you may have felt a little funky for a day, or if you've had a shingles vaccine, you
Yeah.
may have felt that a little bit. A lot of people have reported that. I certainly felt that way when I got mine. Uh, so that type of reaction we aren't surprised by at all. It's very
Mhm.
mild. But we can pay attention to what the risks are. And so we're starting with the people at the highest risk
Mhm.
will be allocated first. And
It
we're
sounds
trying to
like
do this as equitably as possible.
Yeah, that's a good point, and it sounds like children will be much later, and yet there's good news there. In terms of the now, though, in terms of the moment we're in right now, there was, the American Academy of Pediatrics came out, reported a nearly 30% increase in child COVID-19 cases in the last 2 weeks alone. What is your analysis of the huge rise and kind of the place we're at now, though?
So I'm sure everybody's seen all these graphs, right? And we had a peak specifically in Nebraska around May, and now it's really shooting up, the number of cases that we're identifying and the number of people in the hospital. Remember that adults are much more likely to get hospitalized,
Mhm.
especially older adults are much more likely to get hospitalized with this illness and more likely to unfortunately pass away from this. The range between a half to 2%, depending on which data set you look at, of children who are identified as infected have been admitted to the hospital.
So, Dr. Sato, I think I might have missed a little bit of yours. Zoom and WebEx and all the things, they have
It flashed up.
they have their limits. So I'm sorry if I'm making you repeat something here. But I did want to ask, what are we seeing at children's in terms of hospitalizations, and what's kind of the state of Nebraska for COVID in kids? I can see you. I'm not able to hear you.
I feel frozen. Okay.
Oh, there you go.
I know, everything froze for me.
I'm
Okay,
hoping our audience,
so
I think we have grace.
very early on,
Uh-huh.
back in May, we only had a couple percent of the cases were in children.
Mhm.
And I think this is really because children were at home. And initially, the biggest risk was to be around someone who had traveled to Italy or China and had been exposed to someone who had traveled. And so children are relatively protected. But what we've seen happen over the summer and into the fall is that children are a larger percentage of the cases. And we're really seeing the greatest number of infections are in young adults. And then the age groups around that, so children, and then the next age up of adults around there are the fastest growing and um, the most increase really that we're seeing is in those age groups. Some of that probably has to do with kids mixing in society more, right? We have them going to school and then their activities around school. Uh, but because children are exposed to younger adults because that's who their parents and guardians are. So as that population has cases, then children are more exposed just by virtue of who's in their household.
Right.
So now we're up to about 14% of the cases are in children.
Wow. So, Dr. Sato, can you remind people just kind of what are the symptoms, what are the flags to keep that child home, to stay home in general, for children and teens right now?
So Children's has a nice little sign you can put on your refrigerator door that can help you remember the list of symptoms. And we also have an app that you can get on your phone that can help you go through that list. Your school or workplace may have a slightly different list, but it's going to have symptoms like fever, cough, congestion, some GI symptoms, so stomach upset, diarrhea, headache, loss of taste or smell. And in fact, there was just a Canadian study that looked at a very large number of children, about 2,500 children. And the children most likely to test positive when screened by their pediatrician complained of headache or changes in smell and taste as being the most specific. They also had a large number of children who had fever and congestion and sore throat, but because there are lots of other things kids get that cause those symptoms, those were a little less specific, but those were still very common complaints that we saw. One of the problems we have with detecting this illness in people is that people can be infectious to other people without having any symptoms, or for a couple days before they start to develop symptoms. And fever, although most people who develop the syndrome of COVID-19 with this infection do have fever at some point, it's not necessarily the first thing. So we need people to be sort of aware that a new headache, right, a new things just taste off or don't smell normal, that those can be symptoms of developing COVID-19 and that you should stay home.
Yes, err on the side of caution, of course. And we do have a question from Facebook that dovetails. The virus. That's the question. It sounds like it's a yes. What's your answer?
So yes, so we definitely have evidence that children can be infected because that was a question early on, whether the younger children could be infected. But we've definitely seen transmission from and to younger children. We've had various studies that have shown children can have a very high viral load. Now, having a lot of virus in your nose doesn't mean you transmit it as well as somebody older, because children kind of cough differently and they breathe differently than older people, but they also tend to be right up close to you,
Yeah.
right? If you have small children, you know that keeping them separated by 6 feet is actually pretty difficult because they want to be up close to you, they want to snuggle with you, and so they tend to have much more contact with you. So I certainly have more within 6 foot radius contact with my 8-year-old than with my 16-year-old, who hides in his room and doesn't really want to see me most of the day, right? And so there's a difference between whether they transmit and whether they do transmit. There was a very large study in India that showed even with schools being closed down there, that children were able and were spreading infections in their age groups
Hmm.
because they were still exposed to other children in some situations where either you can't separate your living situation, or for care reasons, somebody has to watch them. And the people who are most able to help you often have their own children, right? So we know children can get it. We know children can transmit it. We know children can get sick with it. If a kid's admitted to the hospital, they actually still have a reasonably high chance of needing really a lot of support. And depending on which cluster or case report or series that you look at, you can see a quarter to half of the kids who get admitted may at some point need ICU level care. So it can be very serious. Children have died from this. So it's a very serious infection, and especially with the hope of us being able to produce vaccines within, another year is right now, today feels like forever, but from a vaccine development standpoint, it's really
Amazing.
amazingly impressive.
Yes. Yes.
And previously, our fastest developed vaccine still took a few years when we knew the target and we knew how we wanted to do it. So this is really amazing and great.
Mhm.
I
It's
say just
something to
that.
be thankful for. This
Yes,
thing.
absolutely.
Yeah,
And so it's
medicine.
really important right now that we do our best to avoid getting infected, because we are going to be able to have better protection without the downside of the risk of dying, the risk of lung damage, the risk of other organ damage, right? We've seen this virus cause things like new onset diabetes in children, or autoimmune thyroid disease, or any number of other complications. Affects their hearts. It can affect their other organs, in addition to causing fibrosis or scarring in the lungs. So avoiding that infection is really, really important. And we know that masking works, right? We know that avoiding people works, and it's hard. But if you can view this, then you probably have a way to stay in touch with people that doesn't involve being in person, right? Like Sarah, I don't know what time the last time you and I were in the same room, but it's been a while.
It's been a while. Yeah.
Yeah.
Yeah. We have
But
another.
we're still in touch and talking on a
Exactly.
very frequent basis, right?
Exactly.
And
Yeah.
so we have a connection and we're able to spend time together, but we're not putting each other at risk.
Mhm. We have another question from Facebook, Dr. Sato. If you are able, are we seeing Latino children being affected disproportionately by COVID in the Omaha area? And of course, that's a localized question, but maybe there are some national.
Yeah, no. So if you look, Douglas County has a beautiful dashboard if you want to really get into the weeds of it. And if you click on the little tabs, all these dashboards, they don't necessarily have everything on the front page, but if you kind of fish around, if you're someone who's really looking for specific information, Douglas County's is really nice. It's very detailed. It has different ways where it breaks down children. By age, not just 0 to 19, but they actually have it divided in also in a separate graph, age 2, where it divides it by 5 years. And so you can look at 4 different ages and see that teenagers are more affected than younger children. So that's a great source of information. But I can tell you that across Nebraska and locally, we have seen minority people being more exposed and more affected by both COVID and something called MISC, or the multi-system inflammatory syndrome in children. We've absolutely seen it affecting this population more. And I'm going to tell you that our impression, and that's true nationally too, Latino or Latinx and Black non-Latino patients are disproportionately represented, both for COVID-19 and for MISC. That to me seems to do with their exposure risk, because these are children in families and communities that are essential workers. So In Nebraska, we've had meat packing plants, for example, be involved in outbreaks. And so these are children in families of parents who work in those sorts of environments, or there are other types of essential workers, healthcare workers, right? People who work in nursing homes,
Yeah.
who were more likely to become infected themselves. And so their children were more exposed. And we've absolutely see that happen where we think it's an exposure risk that they have that is different than other children. That said, we are starting to see more in other ethnic groups, and we've actually seen a little bit of balancing out on the COVID numbers. So unfortunately, everybody can get it. Everybody is at risk. So there's nothing, I think, genetically or virally special about those groups. It's just who was exposed and who has been more exposed.
Yeah, well, I'm glad that was an excellent question. Whoever asked it, thank you for asking it. It's such a good point. And we had some other excellent questions from parents come in on Instagram and Facebook. One parent whose child is facing a kidney disease. Another asked about children with congenital heart disease, single ventricle, children with a single ventricle, so just various chronic complex conditions. I think that's really an important thing to touch on, because at Children's, we care for a lot of children with a lot of pediatric specialty needs. So I don't know if you can speak to those. I know kidney and heart were too specific, but in general, you know, if I'm a parent of a child who's already coming to Children's for some specialty needs, like what do I need to know about risk and what I need to do to keep my child safe and healthy?
So we know, right, people I think are pretty aware in grown-ups, things like obesity, diabetes, heart disease, place people at risk. And in children, we've seen very similar things. Children who have dependence on technology, so somebody who might use a ventilator on a regular basis or need IV nutrition on a regular basis, people who are immune suppressed. It's actually not 100% straightforward in the immunosuppressed population. Some of them have done better than we initially had been concerned about. Although by better, I mean as badly as everybody else without that pre-existing condition, right? Because many of our COVID and MIS-C patients have no underlying conditions, but there are these higher risk categories, right? And we know that coronavirus infection during either COVID-19 or MIS-C can have a serious impact on the heart. It can have an increased risk of clotting. It can have serious impact on the gut even. So we think about those pre-existing conditions a lot. And with the new monoclonal antibody therapy that's being offered for people who are not sick enough to be in the hospital yet, who are 12 and up, right? We're looking at that as a treatment to hopefully avoid hospitalization or ER visits. So that is a consideration that we might use something like that for a higher risk patient who qualifies. That's another EUA situation. But we are certainly getting those therapies allocated to Nebraska and to Children's to be available for higher risk patients to hopefully keep them from being hospitalized. So we definitely worry about children with these higher risk conditions. And we recommend really the same thing that we recommend for everybody in terms of doing what you can to wear a mask when you're outside. You know, if you have someone that you think has been exposed and is in your household and you can't separate from them, we actually also recommend wearing a mask in your house, right? So if you have somebody who may have been exposed and you need to keep them away from somebody else who might be medically fragile, trying to not eat at the same time, trying to not share the living room at the same time, and wearing a mask in your home can actually be a really good idea if you have a high risk situation. It's hard, but you know, in those high risk times, then you know we try to do that.
Mm-hmm. You know, we're heading into flu season, and we've heard a lot of talk about the convergence of the flu and COVID, and even the term twindemic. what do you want parents of children and teens to know about the differences, symptom-wise, presentation-wise, between COVID and the flu? Because I feel like that this is kind of coming up, and I imagine it's only going to get more prevalent. Where we're like, what is this? Should I be worried?
Well,
What should I do?
so unfortunately, right, it's not crystal clear up front when you first start to have symptoms if you have one or the other, right? Although we say COVID is worse than flu, because it is, flu can still be very serious and a very bad disease, right? In both situations, you can have an asymptomatic infection. In coronavirus, it's 45% of people are asymptomatic. In influenza infection, it can be like 20% can be asymptomatic. So somebody could infect you without even knowing they were infected. Okay, so all the things we're recommending work great for flu too, right? So if you're wearing a mask, you're actually much less likely to spread flu. And we've actually seen that the Southern Hemisphere has flu during their winter, which is our summer. And they, in countries that were doing things like socially distancing and masking, actually had relatively less flu because people were avoiding sharing their droplets, their aerosols and such by masking and socially distancing. Flu vaccine still is very important.
Yeah.
And we recommend that, everybody who is able to get their flu vaccine. We have years, decades of data on that, even in children. There was even a pediatrics journal study from the American Academy of Pediatrics that showed that even if you got flu, if you've been vaccinated, children are less likely to need ICU care. Children in the ICU are less likely to die. So even if it didn't keep you from becoming infected, because nothing is perfect, if you got infected but you'd been vaccinated, you still had to step up and your immune system was probably a little readier to get going to fight the infection. And so people who have been vaccinated actually do better even if they do get infected, and they're less likely to have a symptomatic infection.
So I guess in some ways, the advice is the same as we would have for the flu, stay home, call your pediatrician, but it's not going to be super clear.
No. I mean, probably on average, your average patient who presents is more likely to have a fever if they're presenting with flu. Right. And the anosmia rarely happens with flu and other infections, but that change in smell or taste is definitely a little bit more
COVID
specific for coronavirus.
Yeah.
Right. So that is a more of a predictor that it's going to be that. We're hoping at some point, we do have tests for both. So if your pediatrician was trying to sort it out, we can test for both. Not, various tests have different.
The lights went out, Dr. Sato.
I know.
Shake my hand. I'm still here. Sorry about that.
That's our lovely office lighting settings.
There you go. We're being eco-friendly. So continue. I'm sorry.
It's okay. So, there are a lot of similarities, unfortunately. And so if your doctor's trying to figure out, do you have flu? Am I going to treat you that way? Or do you have coronavirus and I'm going to exclude you that way? They'll probably end up doing a test for one and then the other if that one's negative, or they might do both. It depends on whether you've been exposed to someone. If you know someone in your house has flu, they might say, well, you probably have flu. So they might just start with that test. So it's going to depend on the exact situation, but we do have testing that we can do for both. And often we can do it on the same swab. So we don't necessarily have to swab your child more than once to be able to do these different tests.
Well, that's good to know. That's good to know. So mentioning testing, we've had some ups and downs. The whole country, the whole world has had ups and downs with testing supplies since the very beginning. Are we in a good place with that right now? I mean, are things kind of evening out where we have enough and everyone who needs a test is getting a test?
So our percent positivity is a measure, when you hear that number thrown around, is a measure of whether you're testing enough people. And our percent positivity in Douglas County has been above 30%, and it's been in the upper teens in the state. And so that number argues that we should be testing more people. It doesn't mean we couldn't necessarily do it, but our goal should be to test more people to make sure we're catching everybody that has it. right? So we expect to have a certain number of negatives to say we're really testing enough people to have a handle on it, right? And you may have heard that in the Dakotas, it's 50, 60% test positivity, which means they really need to be doing more testing if you want to find all the cases. We did nationally have a problem early in the fall, in September, where we couldn't get enough supplies. Because if you think about these different tests, we've never done the scale of testing with
Mhm.
these type of reagents. Just getting the swabs and the right swabs, because they're actually different types of swabs, for each test has been a challenge. Some of them have to go into a special media. And so being able to make that media. And so our lab has been fantastic at resourcing and figuring out how to get different supplies and bringing online different tests that we can do. And we're still in the process of getting other new tests that will be hopefully up and running soon. So our goal is to be able to offer a test to everybody who needs a test. So I think overall we've been doing as well as um, as a state, I think, in terms of being able to offer testing most places. Now, if you're, further away from Omaha, there may be places where it's harder to get a test, right? Or if you're someone who has trouble with transportation,
Mhm.
then you might have a little bit more trouble getting a test. But we're trying our best to get testing to be available to people and to have the appropriate test. I do want to be clear that if you're looking for infection, you need one of these in your nose, or um, some labs are starting to develop saliva tests you may have heard of. Those are technically difficult to manage. And so we don't currently have a test like that, but you may hear of somebody getting a test done like that.
Mhm.
Those tests are looking for active infection. We want to know, do you have virus in your respiratory tract that we can detect now? Okay. If you had a blood test, uh, there's been a couple experimental tests looking for the virus in your bloodstream, but we don't really feel like that is a test that we're using. Uh, Most blood tests are looking for antibodies. So
Mhm.
that test is of questionable value, I would say, in most situations. We don't know for most of the tests that have been developed whether that has any significant meaning in terms of what's going on with you right now. Because if you had infection back in the spring, let's say you and your family got infected in May, and we test you for antibodies now. What we know is that not everybody who gets infected, be it an asymptomatic case or a mild case or even a severe and was hospitalized case, not everybody actually makes antibodies upfront from natural infection. Of the people who have it, some people we can't detect antibodies after a few months. Now, there has been a study that just, it's in preprint, but I think it's going to get published, um, looking at both cell-based uh, immunity and antibody-based immunity. And that looks like it may improve actually over time, and that we may see some people will have longer term immunity, at least out to the 6-month point. But we don't know who that is, or really if we're using the best test to measure for whether you would be safe if you got exposed to a big cloud of virus from someone coughing in your face. So we don't assume that anyone who's had infection is immune. And we don't know that having a test that shows you have antibodies means you're immune.
So we're back to here. This one.
Yeah, and so the other thing, we have these patients who've had COVID, who've had MISC, and again, broken record here, I tell them the same thing, that you need to mask, you need to socially distance, you need to do all those things,
Even if you've had it.
because there have been proven cases of people who have gotten infected more than once. And the reason we know that these individual people have been infected more than once is because these were in the lucky circumstance that we could find, we had the sequence from the virus that they were infected with up front the first time. And then we had the sequence from the time they were infected the second time, and they are different enough that it is not just that same virus persisting in them. There's a little bit of an error rate, right? So you
Right.
expect to see a couple changes per month. If it was just replicating in their nose and still there and still there and still there. And when they compare those, they are very different,
They're separate.
right? And so they are different viruses.
Mhm.
And so that is a real sign of a repeat infection.
That's a good
With people
reminder. You're
who've been
not in the clear.
infected, we don't have the sequence, so we can't prove it.
Mhm.
So we don't know how often it happens that someone gets reinfected, but we know it happens,
Mhm.
right? So that is a big concern for us. And so we tell people, I kind of don't care about your antibody test, right? That may tell me what happened before was
That doesn't mean
probably
anything.
COVID, what happened before, or when a child comes in who
That's
didn't
interesting.
have a known infection, but seems like they have MISC, because that is a post-infectious state,
Mm.
that can help us decide, maybe that kid really does have MISC and we'll treat them for that. But other than that, your antibody test doesn't help me, and it doesn't really help you
Hmm.
because you still have to keep yourself safe.
Yeah, yeah, that's an important perspective. In listening to you talk about some of this stuff, I'm just reminded, talk about we're thankful for the vaccines coming along, how I'm thankful there are people like you who understand this. And I think probably people watching can relate. Like, I'm just so thankful for adult and pediatric healthcare professionals and experts who really have learned so much about this and applied their expertise to it in at such a rapid pace.
Can
Um,
I add the one negative comment that I have to say about the vaccine?
sure.
So, what we know from these studies,
Mhm.
right? And they enrolled 30,000, 40,000 people in each study and all that, right? So we're looking at large numbers of people with very few numbers of infections. Um, they only looked at people who were symptomatic.
Hmm.
So we don't know what effect the vaccine has on asymptomatic infections, whether it changes that, right? We would think it probably does, but we don't know. And we don't know what that does. So people didn't get as severe. So depending on which study you look at, there are zero or very few severe cases in the vaccine group, even with the infections, and more of the severe cases in the placebo groups who got infected. But we don't know um, whether that means they're less infectious to other people or not. So we don't know if the vaccine's going to change the risk for people around you.
Mm-hmm.
It may change whether you end up in the hospital or very sick, which is a great thing. But not all vaccines work the same way. I think this is something most people who don't study vaccines are aware of.
I think you're
But different
right.
vaccines do different things.
Mhm.
And so many of our vaccines don't prevent infection, they prevent disease. And so it may not prevent transmission to someone else. So
Mhm.
it is still just as important that you may not be sick, but you might be infected. And so it's still important for you to wear a mask to protect people around you. And
Right.
we still don't know what that means in the long term. And because we only have very short term data, we don't know how long the vaccine is going to be protective for at this point, or whether
Yeah.
you're going to need a booster in the future.
The masks are not going away anytime soon. So
No,
stock up
get
on some
ones you
cute
like.
ones. Get cute ones. I know in pediatrics, we talked a lot about, characters and fun colors and prints. No, we're so thankful that there are people like you who have this expertise. And I want to turn to um, the term healthcare heroes comes to mind. I don't know if you like that term or not, but I think it's true, and I think people understand it. And I want to ask how are healthcare professionals doing right now? I think we sort of know it's a hard year, but how are you doing? And what does our healthcare team at Children's want people to know? What do you want people to do to kind of, again, cut through all the headlines and just kind of speak from your experience of what this is like?
So for us, again, fortunately, children have been doing better than grown-ups.
Yeah.
My heart completely goes out to people who work in nursing homes, long-term care facilities, prisons, UNMC, adult medicine, um, and also across the country. anyone taking care of the adult population. It's
Yeah.
been really, really hard on people. Um, People have been through a lot of trauma in terms of taking care of sick and dying patients. We've been very fortunate on the children's side to be able to still have family members be at the bedside with our patients. When we were most challenged, we were still able to have one family member, one adult caretaker be at the bedside with our patients. But many adults have been on their own in the hospital, which is scary and hard, and it's hard on the families. And so that has really, um, been hard to
Yeah.
support my colleagues
Yeah.
going through that and dealing with that. And so I feel like they're more heroes than me. um, but it's still hard to take care of a child who's very sick. And it's been a challenge for us, as you say, because we're learning as we go,
Yeah.
right? So now I'm an expert of sorts for two new disease states from a new virus that, before January, I'd never heard about this particular virus. While I have a background dealing with vaccines and viruses and other infections and some research I've done previously, coronaviruses per se weren't what I had spent a lot of time thinking about. And now, I'm learning more about, the different types of coronaviruses. And while I had previously paid a fair amount of attention to SARS and MERS-CoV and been aware of the four sort of normal common cold coronaviruses that are around, things we've been learning as we go in terms of what COVID-19 really is. We focused originally on just the lung part of that disease because we knew it was a respiratory type virus, but we have been learning that it has effects on more and more organs, partly because it goes through blood vessels, right? And so we've been learning about that. And then it wasn't till the end of April that we were even really discussing MISC
Right.
as a new disease. And now, we've submitted to the health department. I think we just submitted another one. So I think we're up to 17 cases we've submitted to the CDC for them to review and decide if they agree with us. Right. And so that has been a new disease.
Yeah.
And we have been, the beautiful thing has been the collaboration in pediatric infectious disease and adult infectious disease and epidemiologists and everybody, cardiologists and
Yeah.
everybody
Together.
really sharing their experience. We have Zoom meetings, we have online forums, we have listservs, we have all this sharing that is happening. If somebody has a protocol, they share it and people comment on it.
Yeah.
It's been amazing, that collaborative effort of everybody really doing their best to help everybody. That's really been phenomenal. I, have gotten pings on my phone at 2 in the morning when someone from Spain sends an update on, right, because they were affected early on
Yeah.
compared to us, right, in Europe and in England. And so they were sharing with us information about how to care for children with this disease, because originally there were very few children to look at and very little experience. And so everybody just set up ways to communicate and share and do our best to keep, our communities healthy and children healthy. And we all are in it trying to help each other all the time. So we're more than happy to take phone calls or share with friends or anyone who, calls from another institution and says, hey, how did you guys solve this problem?
Mhm.
There's been a lot of work. And the amazing thing, children's started really working on this, and I don't think people appreciate this, in January,
Oh yeah.
right? And we set up something called Incident Command. And I remember going to that first Incident Command meeting, and there were like 50 people in a room, back when we were all in a room,
Yeah.
right? And
January.
people representing every aspect,
Mhm.
from um, building people who look at our airflow and people who get food to our patients and the pharmacy. I mean, not just physician, everybody. We got input from everybody, and everybody worked really hard to get, sort of up and rolling and to plan and to make sure that we had the PPE that we were going to need and figuring out what that PPE was, right? Because the advice and the data has changed tremendously over time. If you look in the medical literature between the beginning of the year and now, there are over 75,000, I haven't even looked this week, over 75,000 scientific articles that have been published.
Wow.
Right. And so it's great to have, one of my cardiologists tell me, hey, this group of cardiologists just had this big discussion and this is what I took away from it. Or one of our hematologists, our blood experts say, hey, in terms of anticoagulation, this is what was just shared, right? About how to manage children in these different situations. And so we're all trying to update each other and relying on each other's expertise for each piece of this. And so that to me has been tremendous. And I think that everybody, in both pediatric and adult medicine, is trying really hard to communicate and share and get that information out there and to kind of make sure that things are also on the ethical front, making sure we have access and that we are trying to reach everybody equitably and provide services and treatment and education to everybody. Right. And through Children's, we've been working with the school nurses of Nebraska.
Sure.
To help educate them and to work with them and to look at protocols when they've asked us for a little bit of advice.
I think you've hit on so many important things for people at home to know, is just that collaboration, the dedication to solving this, being a community resource and reaching out to schools and different entities, public health entities, just constant conversation happening. And I think that kind of leads to this we're all in this together mentality. And that's kind of, as we close, where I want to go is Dr. Sato, what is your message? What is the closing statement you want people to know on what they can do to be all in this together and to get us to a better place with this?
So I think if you look across the state, more communities are adding a mask mandate, right? And I think the data is really there. We have all sorts of information that shows that counties around the same city or in the same state, if people are wearing masks, then that rate of rise is not as high, right? So masks really help on a community level. And so if we're thinking towards, what can I do for my community?
Yeah.
Absolutely, the best thing that we can do is have everybody be healthy. And I'm a little upset that people tend to phrase the question like, can we get rid of, control the virus, and can we have a healthy economy? And really, healthy people make a healthy economy. And I think there are ways to do it that we can work together to maintain that. And so, being thoughtful that when you go shopping, if you're wearing a mask, actually, Utah just put out a study today. I haven't gotten to read the whole thing, but they showed that stores where people wear masks actually did better business, which I thought was interesting because people felt more comfortable shopping there, I guess, and spent maybe a little bit more time and bought a few more things. So I think we can all try and do our best to limit our own risk and our risk to people around us. So wearing a mask, avoiding close, crowded conditions, right? If you can work from home, like I am today, then work from home, right? I don't have to come in, so I don't have to share that airspace with people in my division, so I'm working from home. If you can limit gatherings and really just set up to talk like we're talking now, to friends and family, right? Then I can show my whole face, right? A lot of times if I see people at work, I've got a mask and I've got goggles on and and I've got, goggles over my glasses and I'm doing a lot of eyebrow work. But, if I'm talking with a friend, then talking this way is fantastic, right? If I'm talking to family, I can do it this way. And so we can all do these things. You know, I want to support my local restaurant, but I get it to go,
Mhm.
right? If I'm going to splurge and have, somebody else cook my dinner, I still get it to go. If I go to my bakery around the corner from my house, I get it to go, and I go have it at home and sit at my own dining room table and enjoy it there. Because that way I'm keeping the people at my bakery safe. I want them there. I love having them around the corner from me, right? So I want them to do well. And so I go there and I buy my pastries and I bring them home and I eat them at home. And when I'm there, I'm wearing a mask and I'm socially distancing and I'm respecting their space. And if there are too many people, I stay outside until there are fewer people inside that store. And then I go in and I buy what I want. And so my big push besides Thanksgiving is to also think about the day after Thanksgiving, that really
Yeah,
online
Friday.
and curbside pickup
Mhm.
is really an important thing to think about. There is not a bargain out there that's worth your health. It's not worth your family's health, right? I just feel that so deeply, um, that I want people to really say, what's really important, right? The gift I want to give my family is my time, my attention. And yeah, okay, I'd like to get a fun thing now and then. It's fun to give someone a gift and see them open it, which I can do by social media. I can watch them open it. Um, so I have sent a few gifts to people in advance. Uh, but I want to be able to have more fun with them in the future. And so that means everybody needs to stay safe and healthy.
Yeah, we hope everyone watching will take that to heart and share that message with their loved ones. Like you said, not to timestamp this too much, but it's the day before Thanksgiving, and we're aware that gatherings may and should look a little different this year. So thank you. Again, this has been we've covered a lot of ground in this conversation, Dr. Sato. You have so much expertise. I mean, from vaccines to MISC to testing, there's just so much. And I honestly, we've worked with each other throughout this, and to you and to just countless individuals on our team who just show up every day and don the PPE and are reading the new articles and are just connecting with children, even with a mask on. It's truly incredible. It's so inspiring to all our healthcare professionals out there. So thank you, thank you, thank you. And for being here today. And thank you for joining us. I just want to close with two really important resources. Our COVID helpline is available 24/7. So if you have if your kid might have a little runny nose or you have any questions or concerns, it is there to access. It's 402-955-3200. I wish I had like a scrolling number here right now. I don't, but it's on our website. So take advantage of that. And we also have a COVID online resource center for families powered by Children's and Coles Cares. And it has all kinds of content about how do I navigate this mental health. We haven't even talked about mental health. I mean, that's a huge topic in itself. So encourage you to check out that resource as well. Have a very safe Thanksgiving, everyone. And thanks for tuning in. Take care.